Welcome to Delta Rising, a webinar for what the next wave means for theaters. I'm Corinna Schulenburg, the Director of Communications at TCG, and I use she, her pronouns. I'll offer a brief visual description. I'm a white woman in her 40s with blue eyes and hair that is either reddish brown or strawberry blonde, depending on the light. I'm sitting in front of a wooden room divider that I got my wife as a present after our bedroom became our office. And I'm wearing a nice brown shirt. I'm joining you from the lands of the Canarsie and Munsee Lenape. And I'm going to share TCG's land acknowledgement in the chat, or Anne's going to do that. Thank you, Anne. And I will say it. Theater Communication Group's offices are located on the Lenape island of Mannahatta in Lenapehoking, the Lenape homeland. We honor the generations of stewardship Lenape peoples have given to the water, air, and land. As guests, we pay respect to the Lenape peoples, past, present, and future, here in their homeland and throughout the Lenape diaspora. So please feel free to introduce yourselves and share your own land acknowledgements in the chat. And because solidarity with Indigenous peoples means moving beyond acknowledgement into action, we'll also share a resource page in the chat, and we'll have ways to support Native-led movements for justice. So let's get started. I have to tell you all the weird deja vu feeling I'm having right now, because I remember in early March of 2020, when we were in the TCG Situation Room, hosting a coronavirus preparedness webinar. We were completely at capacity. We didn't really know how to do Zoom yet. And we definitely didn't know that a year and a half later, we'd be holding another webinar about coronavirus preparedness. So that is just to say that we have been through a lot over the past 18 months. It's not over yet, but we're going to keep on making our way through this thing together. And to help us do that, we are joined by two extraordinary public health leaders, Dr. Robert L. Murphy, the Executive Director at the Institute for Global Health, and John Philip Fair, Professor of Infectious Diseases at the Feinberg School of Medicine, and Dr. Eduardo Sanchez, the Chief Medical Officer for Prevention at the American Heart Association, and also a board member of Galas Summer Musicals, where he advised on their successful reopening. Thank you both for being with us today. Could you please introduce yourselves, starting with Dr. Sanchez?
Sure, I'm Eduardo Sanchez. I'm talking to y'all from Dallas, Texas. I believe that's the traditional lands of the Kickapoo. I'm so pleased to be with y'all. I do serve as the Chief Medical Officer for Prevention at the American Heart Association. I'm a family physician by training. I'm also a public health physician by training. I had the great honor and privilege of leading the state's health department, the Texas Department of Health, which then became the Texas Department of State Health Services from 2001 to 2006. I have a little bit of post-traumatic stress disorder because I was the Commissioner of Health when 500,000 Louisianans came to visit Texas in 2005, approximately 16 years ago, because of Hurricane Katrina. I'll just share one quick thing. You're probably wondering, how the heck did you end up on the board of Dallas Summer Musicals? And I gotta say, it's because of COVID-19. So I live in a neighborhood where one of my neighbors is actually good friends with Ken Novice, the executive director of Dallas Summer Musicals. I live in a cul-de-sac. I was called, no joke, the Tony Fauci of the sack. And as a result, Toby talked to Ken. Ken called me up. We had a few questions. He had a few questions for me. I ended up on calls like this on more than one occasion. And then I ended up being invited to serve on the board. And I got to tell you that I'm most excited when I'm helping Ken around figuring out how we manage through COVID-19. Other stuff is really interesting to me. I love the arts, but that's the most interesting to me. I'll leave the rest for when we get to Q&A. But thank you for having me, Corinna. Pleased to be with you.
Thank you so much for that. Your care for the arts and theater is like really good to hear. Dr. Murphy, could you please introduce yourself?
Yeah, sure. My name is Rob Murphy. I'm a virologist and trained in infectious diseases. I actually have a chair, the John Fair Chair. I think the interesting thing for you is that he's the father of Liz Fair. You probably heard of Liz Fair. Anyway, she used to be my kid's babysitter. That's as close to entertainment as I got. I'm virology. But I've worked in pandemics. I cut my teeth in the HIV pandemic when I started my fellowship in infectious diseases. I've worked through that in 40 years. And I also worked in the Ebola epidemic in West Africa in the country of Mali, which is just north of Guinea, which was one of the three big countries. Mali had a few cases, but they were much better prepared than Liberia, Sierra Leone, and Guinea. So anyhow, and then of course, COVID came along. And I'm also a professor of biomedical engineering, which I understand Dr. Sanchez has some experience in. And I've been working on making point of care diagnostics related to HIV in Africa. And the NIH in April of 2020, actually April 29th, said, we want you to pivot all your engineering research towards COVID. And I've been working with the Rapid Acceleration of Diagnostics, which is referred to as RADx, which has just pumped lots of millions of dollars into the development of new point of care and easy to use testing devices for COVID. So that's really my background. I've consulted for many companies and institutions in the Chicago area predominantly. And I actually appear on WGN TV. Those of you from Chicago know WGN. And I've had 350 consecutive guest appearances talking about COVID daily since the pandemic started.
Well, we are just so grateful to have you here, not only because, for the opportunity to gain from your experience related to COVID, but just to hear the work that you've been doing more generally. Thank you. So we're going to get right to it. We asked you all attendees to share your questions in advance. Thank you to everyone who did so. I spent some time organizing and editing them down into the list, which we're going to put into the chat now. So if you're like, are we going to ask that later? You can see what we're going to ask. We may need to skip some questions depending on timing. If new questions arise, please do ask them in the chat and we'll work them in as time permits. A reminder that this session is being recorded and we should be able to send that to you early next week. Please also note that I'm about to be out on medical leave for a few weeks. Everything's good. But if you have follow-up questions, to please send them to the amazing Anne Charlone, who is running this webinar with me. And they will put their contact info in the chat right now. So thank you, Em. And now for our questions. And we're going to start with the big picture, and then we're going to move into greater specificity around mitigation. Could the two of you talk about where we are now in the Delta variant wave? I know there's some big news recently from the Biden administration.
Why don't you direct the questions to either one of us?
Sure.
Be a little more specific, otherwise we're
I can do that. Well, you were talking about this, Dr. Sanchez, earlier. If you want to talk about the news from the Biden administration, we can start there.
Sure. The way you put the question, I figured I should defer to the virologist because I'm just a country doc from Texas. I was saying, we were talking earlier, the good news is that yesterday, the National COVID-19 Action Plan came out. And if nothing else, it provides a blueprint that will allow people to know what is being planned and kind of where we're heading. And that's just always better than not knowing. So a plan has been laid out. There's 6 points to it. Vaccinating the unvaccinated. I think that Dr. Murphy and I would totally agree that the best protection is getting vaccinated. Hands down, no argument. That's the best protection. And I'm going to come back to vaccinating the unvaccinated. Further protection for the vaccinated is speaking about the idea of booster vaccines to come later. Keeping schools safely open, which includes providing funding to schools to make them safer. One of the issues has been sometimes we know what needs to be done, we just don't have the resources to do it. And many school districts around the country have known what they'd like to do, but they haven't had the resources to be able to. Number 4 is around increasing testing. I'm definitely going to leave that one to Dr. Murphy. He's in that business. 5, protecting our economic recovery. That's about small business protection. And I imagine many of y'all have explored some of those Small Business Administration opportunities to keep going during COVID. And then the last one is improving care for those with COVID, which includes expanding the accessibility of monoclonal antibody treatment. But I'm going to come back to vaccinating the unvaccinated, because what's called out specifically in that report is, one, that there should be a OSHA rule. That's our a federal organization that provides guidelines around occupation. That rule is going to basically say that employers of 100 plus or more employees, federal workers, healthcare workers, need to think about vaccine or weekly testing to create safe environments in the workplace. There's comments about paid time off for people to be able to get those vaccinations. And then there is a specific call on large entertainment venues, I think theaters count in that category, to require proof of vaccination or testing in order to be admitted to venues. That's already been going on a little bit. Certainly Dallas Summer Musicals did that to do its 2+ week run of Wicked. And there are other entertainers, performers, artists who are saying, in order to attend the show that I'm putting on, I'm expecting 100% either vaccinated or negative testing in order to walk in and be able to see my show. So I'll stop there and just say where we are now is a national COVID-19 action plan. I'm going to leave it to Rob. I'm going to go first name. That's the way I work.
Yes.
I'm going to leave it to Rob to talk a little bit about where we are with the virus itself, because I think there's things to be said.
Okay. The Delta variant has taken over very quickly in the United States. 99% of the isolates tested are this Delta, and it was the real game changer. It's easier to transmit, much easier to transmit, and it caused slightly more severe disease and more disease in younger people and children. Now, part of that is a little bit difficult to really claim outright, because so many older people have been vaccinated, and the vaccines work regardless of what variant it is. Today, actually, or yesterday, some very good data came out that shows that if you're vaccinated, your chance of getting infected is somewhere between 1 in 5,000 and 1 in 10,000 per day. Now, you may think, well, why are you getting infected? Okay, it's easier to transmit. However, it's 1 in 5,000 to 10,000 to get that. It's 1 in 5,000 to 10,000 to get in the hospital. It's 1 in 5,000 to 10,000 to die. You put it all together, and who's in the hospital and who's dying? It's the unvaccinated. So the unvaccinated are still driving this pandemic. And to back up to the Biden administration, what they have said, I guess it's yesterday, is no more Mr. Nice Guy. We've tried to coax you, bribe you, lotteries, gift cards, restaurants, everything. And still there's a significant number of people that don't want to take the vaccine. So this mandate that they're using OSHA as the government regulatory agency to protect workers in the workplace, protect you in the theater, to protect your audience, and the audience to protect you. You've got to be vaccinated. And that mandate adds up to 100 million people. Now, many of those people are already vaccinated, but a whole lot of them are not. And so it's all the people with, as Eduardo said, 100 employees or more, all healthcare workers, the DHHS Head Start program, the entire federal government, the military, all their contractors, all are required now to be vaccinated. In my own school, Northwestern University, is now mandated. And so this is going to make a big difference, because all these things, you have so many weeks from here on out to get vaccinated, and then that's it. You're going to be terminated unless you have a really good excuse not to get vaccinated. I was very happy to hear that the Catholic Church came out and said, we are giving no religious exemptions. That was a very progressive move by their part. So I really appreciated that, because I haven't always been on the same page with them with the schools, where they're keeping schools open and the city schools are closed or whatever. But anyhow, just to follow up on the virus, the vaccines still work. The amount of infections are 10 times less than if you're unvaccinated, and the same for hospitalizations and for death.
So just to follow up on that, how do you see, and Eduardo, feel free to also chime in on this, how do you see things evolving as we head into the winter months, when a lot more people are going to be indoors and we've got the school reopenings?
We don't know what we're doing, I'll tell you. I'm going to just be honest. And at the end of June, the case numbers were so low everywhere. Everybody, the people thought that this was over. We're back. And look how wrong we were. Here we are in summer when everybody's outside, outdoors most of the time. And it's been, a disaster, this fourth wave of infection. Now, the typical respiratory infection does go up as people move indoors in the Northern Hemisphere. And so some people are projecting that we're going to have an increased number, but what's happening like right now, just as people go back to school, go back to work, summer's over, we're starting to see a leveling off in all the states, including the states in the South with the bad rates like Texas and Florida, Alabama, Louisiana, which have terrible, terrible case rate numbers. We're seeing that leveling off. We're seeing the number of new cases going down. Take the macro picture. Every pandemic has ended. No pandemic goes forever. What happens from a virologic standpoint, I'll stick more with the virology, is the pandemic will keep infecting people. Look at the plague, look at the 1918 influenza pandemic worldwide. There were wave after wave, and then all of a sudden, kind of very mysteriously, it kind of went away. And what happened? They didn't have vaccines for those diseases back then, but the population kept getting immunity from the disease, and people still did mitigation efforts with masks and isolating people and social distancing and the like. And so ultimately, this thing will kind of calm down into an endemic nature, kind of like how we have influenza today. And you're going to have vaccines, you're going to have oral therapy. We already have the monoclonal antibodies. We have better treatment in the hospitals. We know how to handle this thing better. And you're going to see an improvement, and it's going to, I wouldn't say burn out, but it'll simmer down, and you'll see waves. You're going to continue to see waves, and it's all going to be driven by the unvaccinated. That's the driver. And that includes right now, unfortunately, kids under 12, because there is no vaccine for them. And the kids from 12 to 18 have a very low vaccine uptake. I'd be interested in Eduardo's opinion about that, because he's a real public health officer. But LA County School District just this week has announced everyone 12 and over has got to be vaccinated to get into the LA school system. You're going to see mandate after mandate after mandate. And this is just going to be a slow cranking thing. They're going to let businesses do what they want. The businesses are behind the mandates. I was just doing a report this morning. The Business Roundtable, the National Association of Manufacturers. These are not like liberal left-wing groups, all right? They support these mandates, and they do it because they can't hardly function with so many people getting sick, quarantining other people. I mean, it's just chaos in the factories and the workplaces and the schools, unless we get this thing under control.
So I'll just jump in and say, couldn't agree with Rob more. So we're probably going to just be agreeing with one another a fair amount. Maybe we can make it interesting. I'll say something that he'll disagree with. I do think that what we know is that as time goes on, whether it's unvaccinated or not, it'll always be a mix of how high can we get those vaccination rates, and how what are the other mitigation strategies that we need to have in place and be able to ramp up. So I also think it does appear that we are on the downside. And if you on the downside of this fourth surge or the flattening of the fourth surge, I think that one thing that Rob was saying without saying it explicitly is that these surges are happening in a slightly different time frame depending on where you are. And there's a couple of states, I think Ohio and Wisconsin come to mind, where they're still on the uptick. They haven't started quite coming down. But to his point, Florida and Louisiana are absolutely on the downside. They're actually, I wouldn't say halfway down on the roller coaster, but they're a good third of the way down on the roller coaster, which probably means that this particular phase of the viral infection is going to calm down a little bit. But another thing is Labor Day just happened. It'll be interesting to see what happens. Rob and I can't predict necessarily that there won't be a little bit of an uptick. And because schools in some parts of the country don't open, that is, and even colleges don't open for still another week or two, we may see some activity, perhaps somewhat attenuated compared to what happened in Louisiana, Texas, and Florida, but we may see some activity in the Northeast and Western states that we haven't seen. So I do agree that it's a combination of the two. And I do agree that for those who are unvaccinated, it's so critically important that everything be done to protect them. And the people they need to be protected from are the adults who are unvaccinated, frankly. It's not the kids who spread as easily as the adults who are spreading. So yeah, that's exactly right. Well, they do have a high unvaccinated. Those are the things that I think Rob and I are saying. And Rob was saying earlier that in a place like Mississippi, it's not out of the question that in 3 or 4 months, either because there's a new variant or some new or something called Thanksgiving happens where you see renewed activity among the the unvaccinated. So completely agree with the unvaccinated part of this.
Thank you both so much for that bigger picture. I'm hoping that we can, and just to say, it's very heartening to hear, to be reminded that pandemics end, even if they become endemic. That's good for us to hear.
But though, you have to keep in mind, this is a global pandemic.
Right.
So even if we get things under control in the United States and everybody goes back to thinking it's all over, there could be other waves just coming in with different variants that are going to require different vaccines unless the entire world gets immunized, gets vaccinated.
That's right.
Thank you for that reminder. Yeah, of the necessity of vaccine justice internationally. I'm curious though, in this next couple months, before it either becomes endemic or we go back to, as you've just said, a new variant, how can theaters evaluate where they are locally to make decisions? What's the best trackable indicator of how prevalent COVID is? Is it positivity rates? Is it something else? What should theaters be using from that kind of set of data to make decisions about their mitigation strategies?
I have a quick answer for that. One, we consider states really out of control if they have more than 15 new cases per 100,000 population. It's a metric that's used everywhere. So first you have to get the number of new cases down. Then you've got to mandate that the entire staff, all the employees, all the actors, everybody working in the theater, even the volunteers have to be vaccinated. And then to get in the door of the theater, you have to show your vaccine card. And you sit down, and right now anyway, with the rates so high, you wear a surgical mask. There was a study done, people wear versus a cloth mask. The surgical mask it looks a little flimsy because it is a little flimsy, but actually the layers in that are actually very effective in cutting the infection rate. And there was a study done in Bangladesh that Yale and Stanford University sort of control and ran. 360,000 people. They showed the mask work and the surgical mask work better. If you walk into Northwestern Memorial Hospital today and you're wearing a cloth mask, they give you another surgical mask to put it on top, or you can take the cloth mask off. So I would say if I was owning a theater, I would, people have to come in with their vaccine card. They have to wear a surgical mask. You can give them one at the door. You can now buy them. There's no shortage of masks anymore. And that everybody in the theater is vaccinated. Look at Lollapalooza compared to Sturgis, the motorcycle rally. Lollapalooza was a shock to everybody. 400,000 people. Granted, it was outdoors, but there's really been very few cases of COVID related to that event. And that event was enormous, 400,000 people in Grant Park. Look at Sturgis. There's cases all over the place because of that motorcycle rally where nobody wore a mask and it was a mess. So we know that when you put these policies in place, they work. And we didn't have vaccines during the last couple waves. How did we get through those waves? We did it because of mitigation efforts that we had at the time. Masking, limiting movement, numbers of people in the same room, more ventilation, all that stuff works, but you have to do it.
Yep. We like to call it, I call it the equation of 3W plus 1V. The 3 W's are wash your hands, watch your distance, wear a mask, and V is get vaccinated. And crowded spaces, good ventilation, all critical things. Those are the things I know that theaters are thinking about. I will also share with you, and I'm happy to share more broadly. I already shared this with Ken Navas. Signage for people is also important so they don't forget. While you're at a place and you're at a venue and you're sitting next to somebody, you might take your mask down and talk. So we've created signage. It's cute signage, dip, sip, and equip. So that if you are at an event at a theater and you're outside and you're in the lobby and you got a drink during intermission, take your mask down to take a sip, put it back on when you're done, is really what that graphic is all about. And I completely concur that when those things are done, you can bring the infectivity rate, the communicability rate down to a very, very, very low level.
So I would love to follow up with that question, Eduardo, because we did have a question related to galas and donor events where there might not just be a sip. There might be an indoor event where people are actually eating a full meal.
Yep.
Or having some food. So, is in that situation, can it be done safely? Or like, what is the mitigation of risk in that kind of situation?
So we just did a big event in Dallas. But, if it was up to me, there's things we just wouldn't do, but sometimes things got to be done. So the thing to figure out is how to do it in the safest way possible. People had to show, so here's what we did. We not only did vaccine or negative test, but we actually provided on-site testing. So we were doing, so if you showed up and we did on-site testing and found that worked. And this was the group, the planning committee was the one that 2 weeks before the event, as Delta variant was beginning to increase, said, hey, we're a little nervous. We want to do this. And I felt like everything they were wanting to do made sense. So the other thing that we did in that event, and I would encourage y'all to do this, to share with one another, is that I suggested we have some folks who just watch. The whole idea is watch what happens so that as we maybe contemplate future events somewhere else, because AHA is a national organization, we take some lessons learned. We actually connected our folks to Dallas Summer Musicals, believe it or not, because Dallas Summer Musicals has really thought about this a lot. One of our issues was that people were walking through hotels where they didn't necessarily have to wear a mask as they got to the venue, got to the place, and we're going to come up with a way that you cannot come in without a mask on. And we found that, and are probably going to do reminders. We arrange seating in such a way that we optimized safety. And if so, not only fully vaccinated, but people were spaced out, didn't have them crowded in as one can sometimes do. And did reminders of put your mask on when you're through eating. Didn't do, discourage people from yelling across the table and from, singing out loud. But those are some things that we tried to do. Rob, does that sound like a smart approach. And you could say no, because I'm always willing to.
No, I mean, no approach is perfect.
Right.
Nothing is 100%. You look at the public health measures, you have to have a package of everything. So vaccination is one part, a very important part. Mitigation strategies are the rest. Making sure everybody in the venue is vaccinated, just like you. All the contractors coming in there, everything. At CineSpace in Chicago, which does all that filming and stuff, everybody's got to be vaccinated, or they get tested like while they're there. They just go get a test, which brings up testing, rapid testing. There is rapid testing now, 15-minute tests. Okay, they're not perfect, but they are certainly better than nothing. And they're better than just taking somebody's temperature. So, you have to put all those things have to just keep up. And then you look at how the rates are going. When the rates go up, you tighten the mitigation efforts. When the rates go down, you can loosen things up. But the vaccine thing does not change. Everybody's got to be vaccinated.
I really appreciated you bringing up the taking of temperature, because that was a question that was submitted. Is that essentially more reassuring than actually useful? I don't know if either of you can speak to that.
The studies have shown that the rate of finding somebody who actually has a specific disease, there's actually more data for this on Ebola, but the findings, it's a very low yield test. Now, certainly, what actually works better is asking them the 5 questions. Have you had a fever? Have you had a cough? do you have any kind of symptoms? That actually works just as good as, a matter of fact, better than the temperature. Because remember, temperatures typically don't go up and stay up. Temperatures kind of go up and down during the day. So you may get in and then still be sick. But so the temperature screening is a low yield procedure, whereas screening for your vaccine card is a high yield procedure.
Thank you for that. I know that a lot of our theaters have said that they're in areas where, for one reason or another, they can't mandate vaccination because of local or state laws. And in those kinds of scenarios, there's a lot of questions around what are the most effective mitigation strategies in absence of a vaccine mandate. And I heard you both talk about rapid testing, and I'm wondering if you could both just give a little bit more information about how could theaters effectively do that? Have you heard of performing arts organizations effectively implement rapid testing in a space?
Well, the problem with the testing is the logistics. Still, you've got a person doing the test, and the person doing the test has to be gowned up and protected, because they're going to be exposed to the person. And then you have to wait the 15 minutes and then discard all the stuff. So yeah, you can do it. But if on a large scale in a big theater, I think it's really pretty much impossible at this particular point. There are some really exciting novel diagnostic tests that are maybe as fast as 30 to 90 seconds that's maybe coming forward. We'll see if they actually really work. But there is a big improvement in the whole diagnostic area. Matter of fact, a silver lining in this whole thing will be diagnostic tests for everything, because this technology is very transferable to other infections and other diseases. So you're going to see a benefit for that. But let's put that in the back. But you can have it, I think it works better like they do at some of the theaters and film spaces, where the people come in, they stagger in, they get tested, they have to hang around for 15, 20 minutes and they get their test, or they do the test themselves and bring it in. You have sort of the honor system, but there's several technologies that actually can take the results and actually feed them into a database, and which ends up on an app on your phone. It's a little bit complicated, but it's not that complicated. And people are using that actually even today.
So, Corinna, I was muted. I guess I said something I shouldn't have said and got censored. Although this is a theater crowd, I know y'all don't believe me.
Not at all.
I'm joking. So, Yeah, agree on the temperature tests. I think don't spend your time there. It might make more sense just to ask people. If you were going to ask people to do anything, I would say, Rob, attest to, I haven't had any of these symptoms. That at least forces people to think about something a little bit. And I'm happy, Corinna or Anne, to figure out how to connect y'all, because I don't want to unleash all of the attendees on our folks on how we did the rapid testing on site. As they say, necessity is the mother of invention. They figured it out. And the thing was that the thing about figuring that out, just one of the points of that is that it made people feel like there was some accommodation for those who might show up and forgot their thing, or whatever it was. There was a way to deal with it that was customer friendly, and it's a thing that you would want to do in advance and work through. So some of this is about meeting people where they are and letting them and recognizing that there are those times where, oh my God, if I have to drive home to go get it, I'm going to miss the whole show. I've been that person because I've left my ticket back before there were electronic tickets.
Yeah, I've also been that person for sure. Thank you for that. Thank you for that invitation. We'll definitely follow up with you. And I'm hoping that we can pivot now to a group of people that are very important to me as a mother, which is our unvaccinated children, and also people who can't get vaccinated for any number of medical reasons. So we had a number of questions related to student matinees. And other student activities where most, if not all, of the children are not going to be vaccinated, and whether you should do them, period. And if you do them, what you should be thinking about.
Are you talking about kids in like a theater venue? Is that really
one of the questions was specifically, should we not do student matinees until like next spring or until children are able to be vaccinated? And others were more about, like acting classes or any sort of,
Yeah, I just wanted to make sure I understood the question. I mean, frankly, they're unvaccinated people. They're smaller than adults, but they are unvaccinated and they are at very high risk. Look what's going on in the schools right now. The schools shouldn't even be open, frankly, but they are. So I think anything with children is going to have to be deferred. Now, the deferral is not a long time. This week, and this date has moved around, but kids down to 12 can get the vaccine. And LA, like we talked about, LA school district is now mandating all kids 12 and over are vaccinated. But the 5 to 11 group supposedly is ready for approval in November. The study is ending in the next 6 weeks, they estimate, and it'll take 1 week to put that data together. So you're talking about middle to the end of November. This is just estimate. And that'll get it down to 5 years of age. And so then you've got to give time for those kids to get vaccinated. They're already getting vaccinated for polio, measles, mumps, rubella, chickenpox, older for hepatitis B. They're already getting tons of vaccines. So this is going to be another one that's going to be added to their list.
And influenza.
Yeah, influenza.
Which is coming up. And so, my advice now is for people over age 65, it's actually influenza vaccine time. And you can get 2 vaccines for the cost of going for 1. So
yeah,
I don't have.
On August 4th, the CDC and FDA agreed that you don't have to you can take them at the same time.
Yeah.
And Novavax is a company coming out with the next vaccine, slightly different mechanism of action. And they have a flu vaccine, and they will be applying for a vaccine that you have flu and COVID together in one shot.
Yeah, I have nothing to add on the kids. I think that we need to be really careful because they're vectors, And while, if you look at the hospitalization rate and then even the mortality rate, while it's low compared to adults, they're preventable. They're preventable, and any child that has it can infect an adult who may not be able to get vaccinated for whatever reason that may be.
Yeah, if you look at the morbidity and mortality of influenza in children, there's approximately 400 or 500 kids per year in the United States die from that. And that's why they mandate these vaccines. It's mostly kids under 5 years of age. With COVID, there's about the same number of deaths, 400 or 500 from COVID. So it's not a big number, but there's a big difference epidemiologically in the children with COVID versus influenza. In that with COVID, it's spread throughout the whole age range. It's not just the under fives. So under 5 mortality is different than like under 12 mortality. So COVID is spread right through the whole age groups and adolescents.
Well, thank you both for speaking to that. My heart certainly dropped when you said the schools shouldn't be open. But I also appreciate that because it does feel like we're just pretending it's going to work out. And it's really stressful.
Yeah.
But moving on to some other mitigation questions, and then we're going to kind of open wide frame again as we get closer to the end. So singing, for theater events that involve singing, we've heard that can be more dangerous. How would you, one person asked, is there like a mask that's really good that you can still hear people, but it's still effective at masking someone? So anything about that particular nuance in terms of mitigation would be helpful.
There's nothing. There's no math that's going to work and be able to sing. I'm sorry. And, if you're going to sing, the only thing you can really do is make sure the ventilation is really good. And there's filters on the HVAC system. And that's a whole controversial area too. We don't really know how effective those things really are. However, it is something. There are companies that are making air filters specifically for this, and they make them for allergens. It's mostly for people with allergies is what they make those for. And they have them on airplanes, because all that air is recirculated as well. But I mean, all you can really do if there has to be singing is to get the singers as far backstage as possible. I mean, back or up, is that upstage, right? To get upstage as far away from the audience as possible. I know there was a couple groups they were trying to do some musicals, and that it was a big theater. They were not even, at 100% occupancy by any means. And so they just pushed the whole audience back 10 rows and just to keep people further apart. But ventilation is key. So any theater is going to have, some, ventilation experts make sure you've got airflow and getting the air out of there.
And that was a really good segue. First off, let's just pause to say, I'm so impressed that you deployed upstage correctly. That was amazing, Rob. You clearly know your theater.
I was in Oklahoma high school.
No, it stayed. That was amazing. But you segued us next into the next question really well, which is if either of you do have specific opinions on what people should look for in ventilation, in HVAC, all of that. What's worth the time and money?
What's the timeline?
What is worth time and money?
What's worth time and money? Excuse me. Yeah. It's just all about ventilation. The more fresh air, the better. If you can go back to 1918 flu epidemic. They didn't even know it was a virus at the time. They thought it was a bacteria. You see, there's the pictures from that pandemic are really great. There's kids with like snow jackets on, and all the windows are open, and their desks are far apart. And basically, we're stuck with the same thing. We can't jam the room with 40 kids and a teacher and an assistant. Those days are over. And they've got to stay at least 3 feet apart. And you've got to have good ventilation. So, these schools have got to be upgraded. Their systems have to be upgraded. And I think it's just in general a good thing to do anyway, just for all the other diseases that kids get. Kids get lots of diseases. They're always spreading stuff at school. So I think some of these efforts that are happening because of COVID will have secondary positive effects as well.
Yeah, that's helpful to remember that investment has other yields. Eduardo, were you going to speak to?
I was just going to add that there is something you can go search on the CDC website about ventilation in buildings. It might not have the degree of specificity, but I think, the bottom line is you need to move air and air needs to be, you can't recirculate indoor air. It needs to be refreshed.
Right.
And that expertise exists in your community. And that expertise of people who know people may be on your boards.
And now you segued us into our next question. This is just going so well. Which has to do with people were wondering, how can we develop meaningful relationships with people like you? Folks who may love the arts, may have been in Oklahoma, and may join a board, or if not join a board, be in some kind of a relationship with a theater to be able to advise in the way that you're doing right now. Do you have any tips for how to cultivate those relationships?
Well, so I would say that, we're still in the midst of the pandemic. So the timing is not the best, but, pick up the phone and reach out to your public health authority, I think is one way to do it. Another is to pick up the phone and reach out, and I'm being figurative here because I know no one picks up a phone. We've always got it in our hand, never was put down. But there's also academic schools of public health. And it just starts with, like everything in this world, it starts with cultivating a relationship and starting with a conversation. It could be a set of questions that you have, an interest that you have. And that's certainly what happened with me, is that I just sort of got connected. And it was a personal connection that resulted in it. But someone's got to take the first step. And I'm telling you, ladies and gentlemen, no public health folks are thinking about theaters to go reach out to. But I also would say to you that if you were to reach out, you'd be surprised at the willingness to engage and the willingness to have a conversation. Public health folk are they're there to serve, and they take that seriously. But again, schools of public health, and I saw San Diego. There's a number of communities where there are schools of public health. I believe Northwestern has a school of public health that y'all can reach out to, and I think people would be more than happy to chat with you. And starts with the first conversation. Rob?
Yeah, no, there are, Chicago is a big city. We've got 7 medical schools, and we have Illinois is a very complicated state. We have 3 departments of health in the state. We have the city of Chicago, which is completely independent. It's like a state. Then we have Cook County, which is, they call it non-Chicago Cook County or suburban Cook County. They have their own health department. And then we have the Illinois Department of Public Health, which is everything other than that. And so we have 3 different sets. So, there are consultants to these people that run it. They oftentimes ask the academics, our opinion. They don't necessarily want us to vote on anything because they're afraid we're going to be too strict, because we typically are. But, there's plenty of experts in every city, in every state, or in every region. And you just have, like what Eduardo said, you just have to develop the relationship with the right one. I've consulted for multiple theater groups, businesses, sports arenas. Everybody's in the same boat. And everybody has these same questions and same issues. We're all in this together. You guys have a particular problem though, because your venues are indoors. Your seating is rather tight. You do have singing and other things that can be a little bit higher risk. So, but you've just got to face those challenges the best as possible. And just keep in mind, there is a light at the end of the tunnel. All pandemics end. This could be the last wave. 90%, actually one study is 94, one is 70, one is 80. People tested have antibodies to coronavirus. And that's because they've either been vaccinated or they've been infected. So there is a move towards herd immunity. We don't know when we're going to get there, but it is going to come. So, we have to hang in there in the interim. You have to do it. If you have to do what you have to do. If you've got to have 50% capacity, okay, do 50% capacity. It's better than zero. And do these mitigation efforts. But start with the vaccines and the masks.
There's a great chat going on about engaging the medical community. No, it's really fantastic with great ideas. And I would just say, in addition to the reaching out and having that first conversation, ask somebody if they're willing to spend 10 minutes, a little bit more time than Rob and me, but spend a little bit of time with the board and just, set it up to be a get to know, but get to make it a kind of a little bit of a short Q&A around, what's happening with COVID-19 in our community could be the conversation. And then one thing leads to another.
So both in the chat and also in our pre-sourced questions, there is this sort of foreboding question that you actually touched on earlier, Rob, which is what happens if there's another variant that is resistant to current vaccines. And the person in the chat posted on a scale of 1 to 10, how worried are you? And I think that's good, given that we're nearly at time. But on a scale of 1 to 10, how worried are you about a vaccine-resistant variant?
Well, that's very easy for a virologist. It's 10. If we don't control this pandemic with the current tools that are available to us now, there will become a vaccine-resistant variant. I mean, that's just has to happen. This thing is so dynamic. So, but if we get it down to where we were at the end of June and keep going in that direction, that is much less likely to happen. So it's not going to happen, but it can happen if we don't control this thing worldwide. So we have to do two things. We have to take care of our own house, take care of the people, do the mitigations, get rid of all this craziness, and help the world get vaccinated. Because if we don't help the world get vaccinated, it's just going to come back to us. They're going to develop the variant. And the variant will come in again after everyone's thinking, oh, everything is great. And then the whole thing will start over again. Now, we'll know what to do this time. We know how to make the mRNA vaccines. One of the beauties of the mRNA vaccine, it's very easy to tweak, to fix, to make it work a little differently so that it'll cover the new variants. The technology is there. mRNA vaccines are not new, by the way. They're over 10 years old. None of them ever got to market. But now they're here, and they're here to stay. Why do you think we had a vaccine that quickly? You ask any infectious disease or public health person last summer if we would have a vaccine in 2020. It was like 99% said no, would never have it in 2020. We were all wrong, and great. I mean, I'm glad I was wrong. But we don't want this whole thing to keep starting over. COVAX is the international group supporting global vaccinations. This could be a charity you could do when things get better here after we clean up our own mess. They had projected 1.9 billion doses of vaccine going out worldwide, and they've just revised their estimate to 1.4. I don't know if you read the international news, but the head of WHO and all these other international people are begging for doses. And they're begging, they're saying, don't give the boosters, we have to vaccinate everybody. The Biden administration says we're going to do both. And actually, we have the technology. We can do both. Making a vaccine actually turns out to be relatively easy. And if you talk about, okay, it's 2 doses, okay, and then 8 months later, you take another dose, that's 3 doses a year. All right, there's 7 billion people, that's 21 billion doses. You got a couple football field sized factories, you can make it. It's not that difficult. UNICEF does this, with vaccinates globally around the world, billions of doses, multiple vaccines. It can be done, but we got to work on this together.
So Corinna, I'll just say, agree that the risk is high. but also agree that we know what to do and we would know how to mitigate and wait until vaccine production got up to speed, but also agree that we cannot just look at the United States because we're one plane ride away from that next variant, period. The degree to which things aren't controlled in other places is the degree to which we're all vulnerable.
So that's a really good place for us to close. I'm noticing that there's some amazing conversation in the chat that's really been supplementing the great information we've been getting from both of you. So I don't know, Anne, if it's possible to save the chat, but we should share that with the archival video. And speaking of the chat, let's show so much love to Dr. Murphy and Dr. Sanchez, Rob and Eduardo. Thank you so much. We are deeply, deeply grateful for your time, for your expertise. Please show them love. Please show them appreciation. There's just a few last things before we go. I'm going to ask Anne to put on our fancy schmancy QR code slide. Because while this webinar and so much of TCG's programming over the last 18 months has been free, we do kindly ask for your support. You can raise your phones to the QR code and like magic, that will work, or you can just go to tcg.org/donate. Your donation will not only support webinars like this, but also TCG Books, American Theater Magazine, all of our convenings, our EDI work, and our federal arts advocacy. So please give if you can. Thank you. And finally, we've got a bunch more programming coming up. Our fall winter season, which is aptly named Crisis and Transformation, is like literally hot off the presses. I think Anne just posted this on our website, and they'll put that in the chat right now so that you can take a look at it. But until then, thank you again to Rob and Eduardo. Thank you again for everyone who submitted questions and joined us today. I hope you all have rejuvenating, restful weekends, and we will see you very soon.